Next is the Housing Committee. Sharon or Taj, please give us a report.
Todd, you want to do it?
Is Torch on? I didn't hear her in the roll call.
Okay, well, okay, this is Sharon. Jamar Ennis provided us with information about a collaboration between the Louisiana Office of Community Development, the Department of Treasury, and the Housing Corporation regarding the COVID-19 housing assistance for renters and landlords, and provided us with a website for those resources. And the Housing Corporation has also created compiled resources for that, and they have that on their website as well. We discussed the information we received from the Fair Housing Action Center regarding the Fair Housing Act and the recommendation we made previously and the feedback we got from it. We discussed the differences between recommendations and modifications, responsible parties and repayment, and related definitions and so on. We discussed about how we could disseminate the information to the parties that really need it. We will be reaching out to the Fair Housing Action Center and see what resources they have available and how we can incorporate that and how we can further get it disseminated. Let's see. We talked about several things. We're trying to get a unified message and to get the information to the right people. And we discussed the meetings that we had with the public comment period for the qualified allocation plan and our pre-meeting meeting. We had quite a bit of discussion about the impact of the qualified allocation public meeting. And we discussed how we could translate the activity and so on from the meetings to match what we are planning and what we are trying to do. We had some differing opinions about it, how it can be done from the developer side and from the tenant side. So we are going to get together and see if we can't work on how we can get the most effective way to do that. We will be doing that shortly. The QAP is going to be having another public comment meeting on July the 8th, and we may or may not be able to get it done for that period, but we will try to. And anyway, we're going to see what can be done most effectively and address the issue one way or the other. We have to wait for the following QAP period, or if we can do it for this one. We had quite a few questions we didn't quite get to. We spent a lot of time on discussing how we can neutralize the provider pushback on a lot of our requests. So we will be continuing to look at that. We discussed the GODA Conference, and we have public comment, and that what we did. Are there any questions? Okay, well, thank you. Oh, John, I see your hand raised.
Just complimenting you on a great report and a good meeting. Thank you.
Oh, thank you, John.
Thank you. Next is Transportation Committee. Mark or Bo, would you please give us a report?
Hey, good afternoon, everybody. In yesterday's Transportation Committee meeting, we met and heard from Slidell resident Bernice Bickham about some of the challenges with transit in Slidell and how improvements in and potentially having a bus line would impact the community from the residents' perspective. After that, I briefly commented about establishing contact with Uber and Lyft about expanding accessible transportation throughout the state. I haven't been able to nail a point person down for that, but we are inviting the City of New Orleans Office of Transportation to speak at our next meeting, specifically the director of that office, Laura Bryan. Following that, we had a long discussion about emergency evacuation procedures and preparedness. Thanks to Miss Amy Dawson for leading that and educating us all about the different departments throughout the state that we can reach out to assist with disabled emergency transit. We did not discuss Medicaid MCOs transportation. There weren't very many legislative updates for transportation related legislation. We did talk briefly about the GODA Conference and putting together a panel, as we did last year, of experts in the region to discuss how we can further improve transit for disabled riders. And there was, the last comment we made was about assigning committee members to continue to outreach to paratransit directors with Bo. And other than that, we had a great meeting. Does anyone have any questions for me? Or Bo? Or both? Going once? Or twice?
Mark, this is Bambi. In regards to legislation, there was discussion about I think it's a House concurrent resolution asking LDH to do a study in regards to medical transportation. The actual legislation didn't pass, but there's a resolution study.
I'm sorry, I did forget that. Thank you, Bambi.
Thank you. Next, the Accessibility Committee. Jim, could you please give the report?
Jim, you're muted.
There we go. How's that?
Can hear you.
All right. So we had a short agenda, but lots of discussion yesterday in the Accessibility Committee. An item of great interest was the HB 446 ADA coordinator position. Had a good talk about that. I think the consensus of the committee was that we should remain involved in this process and in the process of sort of scoping what that job will do and setting up specifications for that position. It will be in the Division of Administration, so it'll fall under D of A HR. But we'll have general oversight of, gubernatorial agencies, and just a general policy, I guess, for the state related to any kind of ADA issues. So that might be employment, it might be accessibility, lots of things. And I think, again, that we felt like this position could act as an advocate and as an ombudsman and do something to try to make sure that agencies have the resources and direction to serve the disability public. We had another item on state building accessibility with a really good presentation by the Commission for the Deaf regarding the history of Pat Smith's legislation, essentially about making the meetings and information at the state capitol available to deaf citizens. Still working on that. It's a work in progress. I think it was noted in the legislative committee this morning that bill passed like 4 years ago. But it sounded to me anyways that the folks working on it feel like we're starting to finally make some progress. We also were supposed to have a presentation by D of A, but that we did not get to that. So we're going to invite them back for next time. We had a good discussion on accessibility for voting. Essentially, I think we felt like the bottom line there was that the commissioners and people involved with the Secretary of State's office specifically that put on the voting, and I guess the registrars locally, probably could use some training and make sure that they're aware of the laws related to disability accommodations and the way that people with disabilities have access to voting. And we're going to try to work on how to make that happen in the future. And we talked about the GODA Conference. And that was pretty much public comment. That was the end of our, Jamar has some great notes on this, by the way. So if you look at the meeting minutes, you can get more details of how the discussions went. And again, back on first item, the ADA coordinator, we need to engage, and anybody who's interested in, what that position might do or what kind of qualifications that person should have is encouraged to let us know. Thank you. Any questions?
Jim, I just had one.
Yeah, John.
There was some discussion about maybe get an RFI out for some agency or organization that could do the technical work to do an audit of what technology exists at the building in question and how that could interface with telecommunications for all sensory impairments. And I think there are a number of companies that you know about and possibly other members of this group. And I would suggest that they send those to Bambi and Jamar so they can get that forwarded to the appropriate people. Because I think it's really more than just a ways and means question. I think everybody realizes that we'd like to have that go forward. And the technology has changed quite a bit in the last 5 years. So there may be some new options for low cost solutions to things that looked overwhelming before. So I want to be quiet, but thanks so much. It was a great overview.
John, you're talking on the item regarding accessibility at the state capitol?
Correct. Yeah, correct.
Yeah.
I think there's actually been a budget developed for that, and it's a matter of getting the leadership to decide how they want to move forward.
Thanks, John. That also I think points out something important about the ADA coordinator position, and that is that technology is changing all the time. So, you know, as we set our expectations of what that person wants to do, I think we need to keep in mind that that person can't be a technologist and a lawyer and, you know, all the different things that we interface with, but they need to know how to access the people that are and utilize them to make sure that we're serving the disability public. That's all I've got, unless there are more questions.
Thank you. Next is the Legislative Committee. Caroline, would you please give us a report?
Absolutely. Thank you, Lynette. Hey, everybody. I'm Caroline Meehan. I was the proxy chair for the Legislative Committee this morning. We had a really good discussion centered around a wrap up from the regular legislative session, which ended last Thursday. GODA was tracking a large number of bills, about 90 bills that had, you know, some bearing on disability services. We didn't go through the whole tracking list, though Bambi does have that available to folks who are interested. But we just hit on kind of some highlights from the session. So I'll just run through those and then I'll tell you a little bit about what we talked about in terms of next steps. So we talked about House Bill 1, which is the FY22 state budget. The disability advocacy community had a large appropriations ask going into the session for all elements of the disability service system. So the waivers, both the DD side and the aging side, ICF community homes and support coordination. We didn't get our full, oh, thank you. Bambi has the link to the legislative items in the chat. So in terms of funding, we did not get our full appropriation ask in HB1. We did get a state general fund appropriation of $16.3 million. With the federal match, that's just over $50 million. That funding was taken from the New Opportunities Waiver Fund, and as a result, it can only be used for the DD side, for DD waiver services. And I'll get back to that point in a minute because we really need to keep pushing to get equitable funding across the entire disability service system. But I'll come back to that with next steps. We also mentioned that HB7 passed. This is provides for a state sales tax exemption on feminine hygiene products and diapers. House Bill 172 provides for Medicaid coverage, comprehensive dental coverage for adults in the DD waiver programs. A task force worked really hard on this and got it through the process. There was also an accompanying resolution in the House directing the Department of Health to study providing comprehensive dental services for ICF residents. And the thought is that next year, after that study is done, we'll be able to run a similar bill for the ICF folks. House Bill 204 was a bill to permanently continue some COVID-related program exceptions in the waiver programs. That bill ended up being pulled, but the Department of Health has assured us that they want to work with advocates and with the disability community to see if there are ways to continue some program flexibilities that have been helpful. I won't go into detail on House Bill 446 because Jim was just talking about that with the ADA coordinator. I will also mention House Bill 294, which makes individuals with disabilities in certain jobs eligible to receive unemployment benefits. And there were a couple of others, but I think those were the main, oh, I'm sorry, the camera bill. The Senate bill, Senator Foyle's bill, SB 86 that requires the governing authority of each public school to develop and adopt policies related to installing video cameras in certain classrooms where special education services are being provided. So it does not, it doesn't compel the schools to put them in place. It just gives parents and students the option to request them. And I'll talk a little bit more about that with next steps too. But that was kind of the wrap up of the session. We talked generally about how this session, probably because the state had a little more money, there wasn't this sort of desperation narrative of people with disabilities and advocates being at the Capitol begging not to be cut. It was really more, Bambi brought this up, a message of empowerment and celebrating, what individuals with disabilities mean in our communities. And so we want to keep that kind of momentum going forward and also continue to advocate for equitable funding across all of the services. So we talked quite a bit about the problems that already exist and will be exacerbated by the fact that only the DD waivers received funding, a special appropriation this year. So we know that means that the aging, the OAAS waivers and services were left out, the community homes were left out, and support coordination was left out. And so the committee wanted to recommend drafting a formal letter just documenting official support for finding equitable funding across all of the disability services. And I see Bambi just put this in the chat too. The Joint Medicaid Oversight Committee is meeting next Friday, June 25th. I believe it's at 9:30 to discuss ongoing issues with service delivery in the disability service system, and specifically to talk about this, the disparity between the way that the different services are funded. So I recommend that y'all check that out, check out the agenda, and if you're not too tired from being at the Capitol, try to get up there next week too. I think it'll be important to have a good show of support. In terms of other follow-up, there was just a lot of discussion around being sure that the bills that are passed are important and they're the first step, but they're not the end of the story. So we really just have to keep working now that the session is over, be sure that things are actually implemented. We talked about the fact that the Accessibility at the Capitol Act that was passed years ago has not been implemented. We need to make sure that resolutions, what they lay out, that the studies are being done, the meetings are being had, so that these gains that we had will actually be realized with implementation. And another kind of immediate next step with the dental bill, Kathy Dwyer noted that we're going to have to ask for that appropriation each year and be sure that it's annualized in the budget. So those are just, just some things we're going to have to keep an eye on and start working on the next session now. And there was quite a bit of discussion about how to follow up on the camera bill in the classrooms. A lot of talk around the setup of the special education advisory councils within the local districts, how to be sure that that there's adequate representation, diversity, that parents are really being heard. And so I think the legislative committee will recommend some next steps for how to be sure that that program has proper oversight. I think that's it. I was looking at Jamar's good notes, so definitely check those out too for a more comprehensive summary. I'm happy to take any questions as well.
Caroline, this is Bambi. I had my spotlight. I believe we had a recommendation from that committee, and so I guess that needs to be presented to the full council for a vote.
Oh, okay. So the recommendation was that GACDA draft, I'm reading it here, draft a formal letter documenting their collective support to make pay equitable among populations. The motion was made by Karen Scallon, seconded by Elaine Harmon. The letter would outline support from GACDA for parity of service rates across the spectrum of disability and elderly service systems in Louisiana, including home and community-based services and ICF-DDs. The motion passed in the committee with no objections, abstention, or further discussion. So do we vote, Bambi? Sorry, I'm just pinch hitting here.
Yeah, it seems like that wasn't the language that the amendment actually, I mean, the recommendation we landed on.
Yeah, the motion, I think actually she described it after she, the description was really what the motion read.
So the parity of service rates across the spectrum of disability and elderly service systems in Louisiana, including home and community-based services and ICF-DDs. Okay, that's what I have in the minutes.
Yeah, no, that's
Not right. It was not the spectrum of services. It was the home and community-based services and ICF-DDs.
right.
So parity of service rates for home and community-based services and ICF-DDs.
For the developmental and elderly population. I think that's.
I apologize, everyone, for getting that wrong.
It's in the chat, Bambi, from the other meeting. I don't know, I can't access it.
Yeah, I see. Okay, so the motion was to recommend the council support the parity of pay rate for DD, home and community-based services, and ICF-DDs, and the elderly, it's waiver services.
Waiver services. Or home and community-based services.
I'd say, yeah, home and community-based, because we don't want to leave out LPCF.
Yeah.
Everyone on the meeting, we spent a long time trying to craft this. Don't have any unintended consequences. So let me recopy this for everyone.
I mean, could it just be parity? I would say parity of reimbursement rate for DD and elderly HCBS and ICF-DDs. Does that make sense?
I think so.
Kathy put it in the chat here, Bambi. It's a motion for a letter in support of parity of pay rate for developmental disability home and community-based and ICF-DD services and elderly home and community-based service system.
That's it.
That's it. Thank you, Kathy.
So that is a recommendation that was made from the legislative committee. So we don't need a motion or a second. We just need approval. Basically, do we have any opposition to this motion? Any abstentions? The motion carries. And Caroline, I guess now we could just open it up if anybody has any questions about the legislative.
Yep.
Or any legislative issue. Any hands raised?
So just for clarity, for me, who would be the only individuals that would be benefiting from what's currently been approved with the 50 million?
So that will be, the programs are all of the DD waivers. So the supports waiver, new opportunities waiver, residential options, and children's choice.
Gotcha. I just wanted to make sure that I was correct on that before I was explained it.
Yes, ma'am. Yeah.
New opportunities, children's choice. What was the other one? I'm sorry.
Supports and residential options row.
Do you know what that increase would be?
So I think it's in the neighborhood of $2 an hour for the reimbursement rate, between
Okay.
$2 and $2.50, I believe. I don't quote me on that, but I think that's what the estimate was. But the folks from the department would have a better, more accurate estimate.
Did any direct service workers get an increase or pay that you were aware of? Not during this legislative session? Just
Oh yeah, I mean, just from the folks in our association, I know most providers have increased pay over the past year, especially, you know, with the kind of COVID workforce crunch. So I would bet most, if not all, at least, of the providers in our association have upped DSP rates.
okay.
Is that not your experience, Councilwoman Taylor? I see you.
Just probably to $8 an hour. I know we were discussing at one time of trying to go and get that increase, but we wanted to make sure that it was equitable across the board. You didn't want to give one group, you know, an increase and not have it for the other, which I totally agree, because you don't want people competing against each other, because then it leaves, you know, our loved ones without many choices. So that's what the one thing that I was concerned about as well, that hopefully that we can get this up to a rate where we're able, you know, to have, you know, quality people caring for our loved ones, for sure.
Absolutely. Yep.
And it's while we have Councilwoman Taylor. Did you have something else to say?
Just
Okay.
thank you.
Well, while we have you, I want to thank you, because there's legislation that we did not talk about that's not directly affecting the disability community, but there was a law passed and Governor Edwards signed yesterday, which was to decriminalize small amounts of possession of marijuana, which we know has caused the incarceration of many people, and we know that our people with disabilities are overly incarcerated. So I think there is an indirect impact. And I know that you, as Councilwoman in Shreveport, led the first step in getting that passed in Shreveport, and then your representative authored the legislation to get it passed. And
Yes.
so I just want to thank you for that.
You're welcome. I am really, really excited about that. I mean, we had bipartisan support on this legislation, which is extremely important. And I tell people, I said, I don't think you understand the impact of what this really does, especially in the essence of reform. I said, so no, it's not legal. And I'm not telling you to go down the street and smoke. That's not what I'm saying. That would be another bill some other time later, if that's what you choose to do. But this right here won't allow you to ruin your life, you know, over a small of marijuana, where you know, cannot access a job or get an educational loan or anything that you plan to do for the rest of your life. So I'm happy about that. And thank Representative Glover and Seabaugh for working together at the state level.
I have just a quick
Definitely.
question. Does that affect the people who have previously been incarcerated due to the small amounts? Does it go retroactive?
It does not. That would be the next thing that I ask them to consider. You want a level of restorative justice. I'm sorry, that's my phone. It consistently rings. Restorative justice for those that are incarcerated. But I do think that that is something definitely that they're looking at. When we passed it at the city level, I told them we don't have any control over that. But one of the things that was very concerning for me is that when we passed this at the city level, you know, Baton Rouge and New Orleans were the other cities that had this similar legislation, it was always what the state had on the books. And sometimes it was like people were going to resort to that. And so that really inspired our push to really get it at the state level. So, it, you know, it would be uniform and there wouldn't be any room for, everybody will be clear as to what the law says. So it wouldn't be any room for disparity.
I agree, Bambi. Great work. Thank you for doing that.
You're more than welcome. I appreciate that.
Yeah. Thank you. And as a native Shreveporter, I'm proud you're leading the way on it up there.
Say yes, Northwest Louisiana.
Uh-huh.
Thank you
Go
for everything
Caddo.
you're doing. Yes.
All right. Well, if there aren't any other questions, I can turn it back over to Lynette.
Thank you.
Lynette, this is Bambi. Do you want to go back to the Education Committee report? Okay. I don't think Robert is going to be able to join us, but let me put my spotlight on. I do have the report. I can share. Just give me a second. Okay. Okay, so we held a meeting for the Education Committee yesterday morning, and April Morgan of Livingston Parish provided a presentation on transition services updates in certain schools. She provided a brief overview of the 20 indicators for the Individuals with Disability Education Act. And specifically emphasizing those indicators related to transportation. And we'll send the presentation with the meeting information. And Dr. Bro, Mary Bro, who's one of our GACDA members, suggested that there be more efforts to coordinate between college programs and local high schools. And there was, in the presentation, there was a slide that gave some recommendations on ways perhaps that these services could be, transition services could be funded within the schools. And I feel like this is something that we really need to focus on and work with LRS, Louisiana Rehabilitation Services, and Louisiana Department of Education, and also our post-secondary education, and try and make improvements there. We also had an update on the April Dunn Act, and there was some documentation on graduation requirements, the comparison between the standard graduation requirements and the requirements of students eligible for the April Dunn Act. And we are going to have some links to, requested some links to some of the data that was referenced, and we'll include that in our reports. In regards to education-related legislative updates, as Caroline had mentioned, she talked about SB 86, which requires public school systems to adopt policies for the installation and operation of video cameras in certain schools. Also, HB 253, it changed the governance of the special schools district, which includes our School for the Blind and School for the Deaf and some other school programs. And so the special school district was, before this legislation, was under the direction of the Louisiana State School Superintendent, and now it will be governed by its own board, similar to the way that charter school systems have their own board, or traditional public parish school systems has their own board. The the special school district will have its own board. And the support of it came because they feel like this is the makeup of the board is more reflective of the people who know the most about this, the students they serve. One bill that failed was HB 324. It was a bill to prohibit corporal punishment in public and secondary schools. If you remember, GACDA had championed a bill a few years ago that passed that prohibits the corporal punishment in schools for students with 504 plans and or has IEPs. But some students with disabilities don't have those plans. And so this legislation would have extended protection for all of our kids, all of our students, I should say. We talked about the GODA Conference, and one of the items on in the GODA Conference list of sessions included a session on education of students who are deaf and or blind. And Ann Jays made a recommendation that someone from LDE, Department of Education, would be on that panel, in addition to someone from the special school district and perhaps someone representing traditional schools that serve students who are deaf and or blind. And then we talked about strategic goal teams, and Robert Garcia gave an update that the Department of Education has stated that the monitoring team is now in process of updating its monitoring checklists, which will be used to utilize the monitoring and implementation of communication plans. It was also recommended that Louisiana Rehabilitation Services begin collaboration with school systems to implement, or should we continue collaborating with school systems to implement the PREETs. And that was the end of the meeting. Any questions? Or comments? Lynette, we'll turn it over to you.
Thank you. Now I will ask for the updates on employment initiatives. Rehabilitation services. Melissa, please give the LRS report.
Hi, good afternoon, everyone. I just have a couple of updates and would be happy to take any questions that you have. LRS was levelly funded for the next state fiscal year, so we are very happy about that. We actually just had our regional managers meeting that actually ended today. And we, had a lot of discussion, which we always have discussion on this, but just how do we improve the quality of services at LRS? Because we recognize that. Obviously, we have room for improvement. We are still trying to make a completely electronic case record, trying to improve virtual services for our consumers who prefer virtual services, although we are seeing people in person. But just definitely an emphasis on how we improve the quality of our services. With pre-employment transition services, we actually are in the process of printing a flyer, and we're also almost finished with a pre-employment transition service brochure that we can distribute to schools and educators and just parents and students, just to help to get the word out on what pre-employment transition services are, so we can increase participation in that program. That last year was obviously very challenging because of the pandemic, but we're hoping to get some of the traction back that we had before that, and really get that program off the ground completely statewide so that all students have access to those services. One other service that we are working on implementing is called customized employment, which is a service for individuals with significant disabilities who have unique needs and may need some type of job carving. So it really involves a high level of work with the client, but also the employer, just to find a really good job match that is best for the consumer's unique needs, as well as the unmet needs of an employer. So we are in the process of training and certifying vendors for that service. They're actually at the point where they will have learning partners, which are consumers with disabilities who need this service. So they're working under the supervision of a mentor who helps them through the process. So we're really excited that we're at that stage of certifying some of these vendors so that we can offer this service more to our consumers. Those are all the updates that I have for right now, but I'd be happy to take any questions about LRS. All right, well, thank you so much.
Thank you. Governor's Office of Disability Affairs. Bambi, please, do you have anything to report?
Hi, yes. So, well, first off, if I can, for Office of Behavioral Health, I received their update for employment. So just let you know, Lynette, Ashley isn't going to be able to be on, so I could give that report as soon as I finish giving mine for GODA. So basically my report is going to be in regards to the state as a model employer task force, and the task force meets the second Friday of each month. We have been meeting over the months in 2021 and having presentations on the recommendations from the state as a model employer task force. And we have some of those presentations recorded and uploaded on our YouTube channel, which is the Governor's Office of Community Programs YouTube channel. We can include those in our in the minutes of the meeting. And I think some of them you're really going to find interesting and just get some insight into what we're doing as a state for people with disabilities in employment. Our next steps for that is to do some marketing in regards to the annual survey we do of state employees in regards to how many state employees we have with disabilities who self-identify, and also around just getting some feedback on different disability related and accessibility related issues. So we're working on that, on some promotional resources, as well as finalizing this year's survey, and should be sending that out in July sometimes, by the end of July. And the last thing, and we talked about this a little bit during the legislative committee, we're talking about kind of some of the things we want to continue in this year to work on for next legislative session. We, of course, got the legislation passed for the state ADA coordinator's office. And the next step would be to have the state as a model employer task force to be, there'd be legislation to put it in law, the creation of it in law. Right now it operates under the authority of an executive order of the governor. And so that would be the next step for that task force. And hopefully we can get that done next year. So that's my update from GODA in regards to employment. And then Lynette, I'll go ahead and tell you, Ashley sent a report, and just that they've opened, and this is from Office of Behavioral Health, and Dr. Ashley Jefferson sent this report. And it is the merged efforts between the current Employment First initiative. So I know they've worked with Office of Behavioral Health, has worked in collaboration with LRS, in their continued planning and implementation around the enhancement of employment services for the behavioral health population in the state, in conjunction with efforts to expand access and availability to these services to the public. And OBH is actively researching and engaging in the application and acceptance practices for entry into IPS Learning Collaborative. And I should know what IPS stands for, but it's supportive employment sort of for people with behavioral health. What does IPS mean? Somebody help me.
I think it's individual placement and support, something like that.
Okay. But that's basically what it is supportive employment for people with mental health issues. They're in the early stages of that process. And also OBH is currently in the process of hiring a supported employment specialist. And this person would lead the OBH efforts for the development and implementation of supported employment services and programs for individuals with behavioral health conditions, including serious mental illness and substance use disorders, and will act as the principal staff to the organization and implementation of supported employment services. So that's exciting news from OBH. And that's it. Any questions in regards to GODA's report? I can't give any more in regards to OBH. Okay, Lynette.
Thank you. OCDD. Julie, would you please give us the report?
I think we have Bernard who is on Julie today.
Bambi, can you hear me?
Yes, I can hear you.
Okay, sorry I don't have a camera. I'm in my office and I have an ancient desktop, so y'all can't see my wonderful face today. I apologize. And let me know if I'm talking too fast, so you can catch it. But just a quick update, and this is relative to employment, right?
Yes, sir.
Okay, so real quick, as most of you may know, that we're still working on the vocational service redesign. And the plan is to incorporate that into the waiver permanently. So that's still underway. We're about 75% of the way done. Also, you guys know that we added a virtual day hab option with the Appendix K due to the public health emergency, and that's accessible now. I believe the day hab facilities are allowed to open. And we're still allowing flexibility around that for individuals who may not want to return. There's still that virtual option. And for folks that do return, there are some I don't want to say restrictions, but there are some requirements that need to be met to continue day hab. We'll have more next month, hopefully, once we kind of finish finalizing the vocational redesign and the rates and the services and stuff like that to present. But that's all I got as far as an update relative to employment. Any questions?
Thank you.
Thanks.
Now we will ask for the updates from Department of Health. First, Office of Aging and Adult Services. Elizabeth, would you please give the update?
I don't see Elizabeth. I think Dr. Lopez is on though. Dr. Lopez, will you be given the update for Office of Aging? He may have stepped away. We're a little bit early on the agenda, so maybe go to the next office.
Next, Office of Behavioral Health. Ashley, would you please give an update?
I will be Ashley again. Ashley sent in her report for the Office of Behavioral Health. They're doing an education series, including sessions in the community. It's called Community Opioid Symposium Virtual Series, and is hosted by the Women's Foundation. And actually, it'll be tomorrow at noon. I can drop that link in the chat when I finish giving the report. Also, the OBH's COVID-19 response efforts are ongoing. And so the majority of the LGEs, or the human service districts, are participating in the COVID-19 emergency grant from SAMHSA, which is a federal agency. So they're able to provide, it allows them to provide services for serious mental illness and serious emotional disturbance and substance abuse disorders. And some support to the healthcare practitioners. She also sent some additional resources for behavioral health for the public, which we can share with you guys. And also there's just an update on the Department of Justice agreement, which has to do with a judgment from the Department of Justice to transition people with mental illness out of nursing homes. And it's called the My Choice Initiative. And OBH has successfully transitioned 66 individuals from nursing facilities back into the community. And that's to date. And the LDH My Choice project director is Christy Johnson. And it's christy.johnson@la.gov. And then she says, if anyone has any questions, it's Dr. Jefferson's email is ashley.jefferson@la.gov. And that's the end of the report for Office of Behavioral Health.
Thank you.
I think that's it. That was the last one. Oh, no. Public health.
Next, OCDD.
No, sorry.
Julie, could you please give an update?
Sorry about that.
I think that's correct. It would be OCDD.
You okay?
Yep, I think we're up. Okay, it's me. Is it me?
Yes, Benoit.
Again?
You're Julie now.
All right, so real quick, as far as our updates specific to overall LDH, I'm going to focus more on like implementation post-session, post-legislative session. And Caroline, fortunately or unfortunately, stole a lot of my thunder. So just real quick, I just want to touch on what we're doing in OCDD relative to a lot of the resolutions that were either proposed and are passed along with any bills. So I'll start with the most positive one, which was the HB 172, which was the comprehensive dental bill. That's signed into law, I believe, and LDH is actually coordinating a work group. That's Medicaid that's going to lead that work group around implementation relative to the comprehensive dental bill. So that's the first update regarding that. Positive news. Next, kind of what Caroline touched on with the HB 204, which was deferred. LDH did give a commitment that we would continue to work on incorporating those recommendations from that bill into the waiver long term or into our services long term. And that is underway. And we vow to give periodic updates to Rep. Turner regarding the progress around that. As you all know, with that, that some of it may include state plan amendments, rule updates, or new rules all in themselves. So that's rulemaking, as well as amending the waiver. So while those things we did commit to them, I just want to give everybody a heads up. It may take some months to get put in long term, but keep in mind those services and those exceptions are still accessible under the public health emergency in the Appendix K exception, which is the waiver exception piece. Also specific to that, we are continuing to look at other exceptions that weren't included in HB 204 to kind of study feasibility long term. The other exceptions is at a super high level. Those are like the virtual services, the MIC, that's the monitor in-home caregiving. That's already into some of the waivers permanent that we plan to put in permanently into some of the waivers. There was the family as paid caregiver, which was slightly different than what was proposed in 204. So there's a bunch of different things in those appendix exceptions that we're working on looking at long term. Not saying that we're going to do them, just saying that we are looking at those. Next is the rate increase thing that you guys talked about. Caroline kind of touched on. That was where LDH, and I don't want to say OCD, but LDH was line item some money to be directed to stabilizing the DD service, and then the subsequent amendment on the floor from Rep. Edmonds that kind of directed that money to be used, I don't want to say specifically, but to be used to address rates. Part of it to go directly to the workers, and the other part to kind of account for additional costs that providers may have on the operating side. So yes, I know there was a question earlier that was asking like how much of that money is going to the workers. We actually have a work group that we've put together. We got Bambi on it from GODA. We have representation from DD Council. We have family advocates. We have advocates, and we have the providers all in the same work group to kind of help us figure out what would be the best course of action. Because the piece that's not really being highlighted here that we need to highlight is that the expectation from the legislator is some accountability to assure that some of that money is going to the workers directly. So that work group is to kind of help us figure all of that out. And we had an initial meeting. It was really positive. We all had some homework, and we're working on setting up another meeting now. Another big thing that Julie asked me to touch on was the FMAP increase that was a result of the American Rescue Act. We are researching that. It's very, very confusing. So I ask you all to just bear with us. The funding mechanism and the reimbursement model is extremely complicated, but CMS wanted to make sure that those funds were reinvested into home and community-based services. So that is a positive. So if you guys can bear with us, I don't want to say there's a guarantee, but that's the plan. That's the intention from CMS is for those services to come back to waiver services and other home and community-based services that may not be in the waiver, like home health and some other things. So that's all I got. I know I'm probably went over, pardon me, but I just wanted to make sure you guys kind of got that information, and I'll open it up for any questions.
Bernard, I have a question in regards to the last statement that you made.
Okay.
You said those funds are for, that CMS is really emphasizing that's for home and community-based services. And I assume that that's across DD,
Yes.
elderly, behavioral health, all of that.
Even OBH as well. Some mental health services that are considered home and community-based services are included also. Like I said, home health is included, and that's not a waiver service. Well, you know what I mean. For kids, it's not a waiver service, but it's a state plan service generally. So that's a Medicaid service that may be eligible. So yes, there's a lot there, and we're still trying to unpack it. Okay, anything else? All right, bye. Before I get myself in trouble, I'm going to mute my phone now.
Thanks, Bernard.
All right, bye.
Oh, Kathy Dwyer has her hand raised. I'm sorry, Bernard. It wasn't quick enough.
Okay.
I'm sorry, Bernard. I was a little bit slow on that. The work group you were talking about for HB 172, is that just going to be Medicaid and OCDD personnel, or would that include family members as well?
I believe they're bringing you guys in. I just said Medicaid was leading it. That's all I got. I know they're going to lead. They're in charge of implementation for that. And the last thing I heard from them was that they were intending to put together a work group.
Awesome.
I will
Thank you,
find out
Bernard.
more information to see what the extent of the participants will be, and I'll let you guys. I'll shoot it to Bambi, and she can get it to the group.
Okay. Thank you so much.
Okay.
Appreciate all that you're doing. Thank you.
Yeah. And just to make sure, in case people don't know what 172 is, that is the dental.
How you doing?
For people without, people with developmental disabilities.
Okay.
And great work, Kathy. Let me say that. Kathy and Mary Kay and the rest of the dental task force, great work for advocating for that service.
Kathy did a tremendous job on that. She's done a lot of that. She did really, really well.
Yeah.
Thank
Mary
you.
Kay too. I don't want to leave Mary Kay.
Yeah, Mary Kay has been a huge help. The whole dental task force, everyone, Kelly, Ashley, Karen, the Louisiana Dental Association, representatives from the dental school. We have a long list of people on the task force, and everyone was very helpful. So it was a wonderful team effort, and I'm really enjoying working with everyone. So thank you. And including OCDD, Bernard, y'all have been helpful with all our questions too. So
absolutely.
Yes.
Yeah, absolutely welcome.
Thank you.
If I can, Lynette, Kathy, can you turn your camera back on? Kathy is very gracious, and it is a team effort, but Kathy has been a leader for as long as I can remember in so many efforts, and you did bring a team together, but you are a leader. And don't start crying, because I'll start crying. But I really wanted to, it's not just this. You are always a leader, whether it be an emergency, we have an emergency going on in the state, or, the previous governor vetoing funds. So I appreciate everything that you've done. And I know our families and our people with disabilities are better off because of your advocacy. So thank you.
Well, I appreciate the support from you and everyone, all my fellow advocates, because we do it together. So everybody has their strengths that contribute to everything we do. And I've learned so much from all of you. So thank you.
Bambi, I echo your same sentiments. It is finally great to see her face. You see all of her messages, and I'm like, who is this brilliant lady? So thank you so very much, because my son would definitely take advantage of that. With the dental. It is so very needed.
Good.
Okay, ma'am, can I go now?
You better leave.
All right.
Lynette, I don't know if Dr. Lopez has made it back on for him to give the report for Office of Aging yet.
I am here, yes.
Hi. Dr. Lopez, do you want to give a report for Office of Aging?
Yes, ma'am, but I'll be happy to. Hold on, let me put myself on camera. And it'll help if I open the camera. Thank you. Good afternoon to everybody. I'm glad to be here. It's a brief report, but perhaps something that is of interest to the community. The Office of Aging and Adult Services, in collaboration with the Office for Citizens with Developmental Disability, OCDD, has continued to provide vaccination, event dates and times, and registration support to all home and community-based services providers and the support coordination agencies. These providers and support coordination agencies are able to provide to their own staff, as well as program recipients, information regarding vaccine locations, events, dates, times, etc., and also support logistics on attendance. To date, over 5,800 participants of our agencies of OAAS, HCBS programs are fully vaccinated. So we consider that significant progress in all of these efforts. Thank you. If you have any questions, I'll be happy to address them. Hearing none, that is my report, Ms. Plotz.
Thank you.
Thank you. Does anyone have any other updates or comments?
Lynette, I think the last office for LDH is Office of Public Health. Is that what you have next?
We just did it? No,
Uh,
you don't have it
You
on?
don't have that one? Yeah, she does. Next
Okay.
Office of Public Health. You want me to, you can get down?
Next is Office of Public Health.
Didn't have a name for it. Miss Patty.
Dr. Bearvecchio or?
I can start off with the Title V Children and Youth with Special Healthcare Needs Programs updates. We did want to provide an update for our clinical services for the subspecialty clinics that are around the state. During COVID, they had moved to telehealth visits. Most of the clinics now are back providing direct services face-to-face, although this is at the discretion of each regional department. If you need more information on this, I can put the link to the information on Children's Special Health Services clinics in the chat box when I'm finished. As far as resource and referral services, the Bureau of Family Health's Family Resource Center now functions as a statewide virtual resource center. And this is to serve children and youth with special health care needs, their families, providers, and any other family needing resource and referral services. They make community referrals, provide CD19 resources. They can support health and transition needs and system navigation. And this can be health and or education system navigation. And they do this in partnership. We work very closely with Families Helping Families and make referrals to that support agency when the family may benefit from those services. The Family Resource Center is also beginning a pilot sometime this summer to do direct outreach to those families who are identified through birth defects monitoring surveillance. And so they will receive a postcard alerting them that someone will be calling. There will be an option for them to opt out if they are not in need of these services, but we will be making sure that all families are aware of the resource and referral services available through the Family Resource Center. I can also put the email. The Family Resource Center can be reached via phone or by email from 8 to 4, Monday through Friday. And last update is for our Children's Special Health Services Transportation Program. This program is available to eligible families who have a child or youth with special health care needs that may meet the medical criteria. The caveat to this program, those children or youth covered through Medicaid must go through their MCO first for transportation supports. And if those services do not fit the need, then they can submit an application for the CSHS transportation program. They can get information about this program from the Family Resource Center or their community Families Helping Families. And I'm going to hand it off to Jana if there's no questions for me.
Okay, so hi, this is Jana Broussard. I'm the Interim Director for the Louisiana Commission for the Deaf, and we want to provide you with a brief update. Aside from our day-to-day operations, we do have three big initiatives that we are working on that we wanted you to be aware of. One of them, I believe, was mentioned during the Accessibility Committee report surrounding a request for information that we'll be putting out shortly. We're looking for we're trying to assess the capacity of an organization to come into the state capitol and review their current policies and technology capabilities in providing communication access to the legislative sessions for persons who are deaf, deafblind, or hard of hearing. So in the next couple of weeks, that will be out. So if you know of any organization that would maybe be able to fulfill this need, we ask that you be on the lookout for their request for information, or you can reach out directly to our office. The next big initiative that we are doing, let me just scroll down for a second, if you don't mind. Okay, so some of you may be aware or remember of the House Concurrent Resolution Study Committee of the 2019 legislative session, HCR 80, that worked with Louisiana Department of Health, Louisiana Commission for the Deaf, for communication access for patients who may be deaf, deafblind, or hard of hearing. One of the recommendations, number 2 specifically, that came out of that study committee was that the Department of Health and the Commission for the Deaf should support the adoption of best practices to support effective communication in hospitals, nursing homes, et cetera. So the Commission for the Deaf has now contracted with an organization called 2ACSIND for fiscal year 22, and they are going to do the consultation, facilitation, and assessment to support and promote the health equity through an evidence-based best practices guidelines. So they are going to create this guideline book that can be posted on websites and then also dispersed throughout the medical provider community on how to communicate with a deaf, deafblind patient, certain expectations, acknowledge gaps in equity, et cetera. So we're really excited to see that, that piece move forward. And then last but not least, our service support service provider program, or SSP program, that provides services specifically for individuals who are both deaf and blind, is moving to a request for proposal, RFP. Similarly, that should be ready. We anticipate sometime in early July that request for proposal will be published. It is a statewide program, and we are looking for one agency to be able to provide the services for a deafblind, for one-on-one service support through trained guides, support service providers. Currently, it is housed in one agency that kind of supports the other regional service centers we have throughout the state. And the program has grown, and an RFP is now required. So again, just please be on the lookout for that. Please share that information with organizations or individuals who may be interested. And that's all I have from the commission, unless somebody has any questions.
We have a hand raised from Ms. Karonda Corley.
Great afternoon, and thank you so much. I'm curious as to, I understand that we're trying to make things more accessible for the deaf, blind, and hard of hearing. But are we aware that many individuals with disabilities that are not deaf, blind, or hard of hearing actually need ASL services and have a problem with accessing that, or accessing any type of modality that allow them a way to actually be able to communicate? So are we taking a consideration for that? And will these services that we're talking about right now only be for deaf, blind, hard of hearing? Because, and I'm speaking as a parent right now, not just as an advocate, but one thing that I think everyone probably don't realize is my child is not deaf, blind, hard of hearing, but my child communicates first language, ASL. So how can he access that? He does not qualify to go into the school for the deaf or the blind, but he has to use ASL to communicate. And every modality that every system that we go across, actually making sure that children or individuals like him that are nonverbal have a successful or accessible means of communication is never addressed. Even as it relates to emergency preparedness services, he cannot call 911 and actually tell them there's an emergency. So that's just something that I'm curious on if we're looking at and taking into consideration.
So I'm not sure if someone else has a response in addition to mine. I do know with the Commission for the Deaf, the way that our legislation is written, it actually does include and speech-related disorders. Now, I'm not a lawyer, but I do believe that that kind of segment should cover individuals such as your son or other related individuals who may use American Sign Language or need additional communication supports. And I would absolutely be happy to talk, more about, some opportunities, I think, for the commission to ensure that they're including this demographic. As far as education and those types of other related services is outside a bit of the scope of the commission, but certainly we would be willing to, support you in any way possible of trying to ensure that individuals like your son are included in these services.
That's a very good point that Karan brought up. So I appreciate you bringing that up.
Thank you. Does anyone have any other updates or comments?
Lynette, is this for any of the other state agencies, or are you talking about LDH?
One Governor's Office of Disability Affairs Conference.
So I think that your previous comment was any other updates was for our state agencies or any of our GACDA members. Now is the time to share any updates that you guys have.
Hey, Bambi, this is Amy from GOSAP.
Yeah, I'm gonna spotlight you.
The only thing I wanted to mention for those of you who are on the call, our office is monitoring Invest 92, I believe it is. It's right now low pressure in the Bay of Campeche. So it's just a low pressure system that we do expect to intensify in the next couple of days. We start our parish conference calls this afternoon to try to assess where the parishes are in their preparedness and possible response efforts. So I just challenge you guys to work with your consumers and your families to get their emergency preparedness plan together for this season, because we're coming out the gate, hot this year. So be on the lookout, and I can't stress how important it is to pay attention to your local officials and contact your local office of emergency preparedness if you need assistance.
Thanks, Amy. Do we have any of our other agencies that have any updates? And I would just say, as most of you know, with the Emergency Management Disability and Aging Coalition, if we have information that we need to share with large groups, all of you guys that are on our GACDA email list or included in our MDAC list. So you should get information, and we really need you guys to help out, whenever we have those type of situations, to help to make sure we're disseminating that information to as many people as possible.
Bambi?
Is that Jim?
Yeah. Is now an appropriate time to discuss the AI call you had me on a month ago?
Yeah, that'd be great.
Okay. So got one of those emails from Bambi. Hey, there's a call today. I actually listened to it on the way to the doctor. But it's an issue that I think we all need to at least be aware of. And it has to do with AI, right? Artificial intelligence. And the call was, and Bambi, correct me if I'm wrong, but it was like state HR or state disability program directors, something like that.
Yeah, it's basically my counterparts, like the
that.
state disability. Yeah, my counterparts in other states.
Right.
Mm-hmm.
And they had a short presentation on the use of artificial intelligence in screening applicants in state government. Some states are doing this. I don't know that we're doing it here in Louisiana. But the concern was that, well, quick AI primer, artificial intelligence just looks at lots of stuff, simultaneously collects all kinds of data, and then develops sort of norms, let's call them, likelihoods, the distribution of responses that that the target applicants are producing. And those responses could be everything from actual question responses to, in some of these, there were video interviews. So the way they looked at the camera or communicated with the interviewer. Also latency. So if they answered the question right away, or it took them a few minutes, that kind of thing. So the issue came up regarding the use of artificial intelligence technology to screen, state employees, I guess, in this case, or maybe all employees, and how there was, if there were no people with disabilities in the training group, there would be no norms that related to the way, say, a blind person or a deaf person or somebody that uses some sort of alternative technique to respond to the interview might answer that. The bottom line here is that if you're looking at a lot of little technical things, like how long it takes to answer a question is a simple one, that's not particularly fair to someone who might be using a different means to communicate. So there were a lot of people from around the country on this call. Like I said, there were a few states that are actually using these kind of things. There was a discussion, well, if there are no people with disabilities in the training group, then you would never have, then the AI would not have ever experienced a person with a disability and couldn't include them in the norms properly. Even if you ask the question whether the person is disabled or not, which you typically can't do in a job interview kind of situation or an application. then that really wouldn't account for that. So I just wanted to get on people's radar this issue about the use of artificial intelligence in screening applications and applicants for jobs. If you hear of any of that, I'd be interested in knowing some more about it. And I think we need to monitor the situation and watch out. That was pretty much the gist of the conversation.
Thanks, Jim. Does anybody have any questions about that?
But I should probably make clear, while somebody's coming up with questions, that I actually made the statement, and I think this is true. It's not the technology that's the problem here. It's the application of the technology. And again, that kind of relates to whether there are any disabled people in the training set to develop norms from. And that the people that are actually using that technology for this purpose actually understand this, or if it's just a black box to them. I think those are the issues here. Questions?
John?
Yeah, I'm one of the resident nerds that remembers when AI was just learning about human intelligence. And a couple of examples are early on, the development of web-based communications got real excited about graphical user interfaces, which totally left out folks that are non-sighted, and they had to come back and figure out how to, patch that back in, making the information reasonably accessible. It's still a problem with PDFs. One of the challenges with Zoom is that our non-sighted users can't use the chat box as easily as we can. So there's
My guys either.
There's a lot of nuances about the AI interviews or AI augmented interviews that really need to be teased out with special interest groups. So I'm thankful that, Jim, you were on that call.
Yeah, I had no idea. I've used AI in some of my technical applications. I use it a lot in things like remote sensing, image analysis, all the stuff you hear about, things like facial recognition. Those kind of things are using things like machine learning and AI, where they can just handle a huge amount of data over a relatively small period of time. But I'm not sure that this is an appropriate application at this point.
Thanks, Jim. And I sent the that link to the recording of that meeting to everyone after the meeting. So everyone should have received that. That was about a month ago, I believe. But time.
Yeah, it was about a month. Yeah.
Thanks, Jim.
Thank you.
Does anyone else have anything else to share? Any of our state agencies or your organizations? Do you have any updates from your organizations? So Lynette, I don't see any hand raised.
I will now ask Yamar to talk about the 2021 Governor's Office of Disability Affairs Conference.
If he has anything.
Sorry, I had trouble unmuting myself. All right, so we have our scheduled conference, GODA Conference, on July 26th, that entire week. We're proposing that we have shortened days to further accommodate our participants' guest schedules. So we're trying this out. So this week, it'll be scheduled during the week of the anniversary of the signing of the Americans with Disabilities Day. So we're kind of celebrating that in the spirit of our conference. So on the screen, we have a few proposed sessions that we're currently working on getting our speakers and presenters for. So we have some very good topics, we believe, that will provide some new information and kind of a robust exchange of ideas in the spirit of the ADA, and keeping in mind the topics that are going on that are important to us. So the theme of this year's conference is moving forward. We thought that that's kind of appropriate as we went through a lot last year with the pandemic and hurricanes and other natural disasters that we really just want to truly move forward from. So as you're looking at the screen, please take a look and just have some kind of opinions on what you think. We're curious to get your feedback. So we hope that this conference, which will be virtual, by the way, via Zoom, and we've heard some really good, favorable things about our conference in the virtual space. So we're going to replicate that this year and hopefully have the same effect. So that's all I had to share at this time. So once things become more concrete, we will distribute our flyer and our registration, probably via the newsletter, but I'm sure that everyone in attendance on this meeting will get access to it beforehand via email. Bambi, was there anything that you wanted to add that I missed?
Yeah, so as Jamar said, on the screen, you can see all of the sessions. Like, it's just a draft and it is sorted by the areas that from GACDA's position statements. And but if there's any holes or any sessions that you think needs to be included, please let us know. You can let us know now, or in sessions, as well as like who can present the sessions. We don't have a lot of time to do the work to recruit people or to figure things out. So, but if you have, you know a topic and a good presenter on something that would really be meaningful, it'd be great. The sessions are typically about 50 minutes. If it's a larger topic, we might make it go a little bit longer. Maybe an hour and 15 minutes. I think that was the 2 different time differentials last year. And some of them are panel format. Some of them are just one presenter on a specific topic. So there's different formats, but we really would appreciate your input on topics and presenters.
This is Jessica Michaud. For health education, COVID, and vaccinations, I know we've talked about that a lot over the last year, but I was thinking about specifically focusing on children and going back to school and just the potential mask, not mask, like what we can look forward to in the next year or predict in the next year. And then predictions for overall people with disability, regardless of age. Maybe focusing on those 2 specifics.
Okay.
Because we see a lot of those who don't vaccinate for good reasons, for health reasons, can't vaccinate. And then those that do, and there's still a lot of fear. So if we can have very specific information.
Thank you. That's good feedback. Any other feedback?
Hey, Bambi, when we were talking about the housing and transportation yesterday, I actually did have an opportunity to speak to Representative Mike Eccles about House Bill 91.
Okay.
And he said that the bill was tabled. And for those who may have not been on the committee meeting, House Bill 91 was something that was written or authored by Representative Mike Eccles in regards to public, well, non-emergency medical transportation opening up to larger franchises to be able to provide the services such as like Uber or Lyft or any other business that wanted to vie for the opportunity. So in speaking with him today, he did give an update. He said that it was tabled. There's a special committee that has been put together, a RFP for the business, advertising the opportunity to participate is supposed to be given out within the next week to 2 to 3 weeks. So I didn't know if that was maybe something we maybe would want to talk about within the housing and transportation. I don't know.
Yeah, definitely.
Okay.
Thank you.
So I will get with him to see if he could join and give an update under the housing and transportation topic.
Thank you, Kirsten.
Okay, no problem.
Bambi, I'm gonna try and get Sam Buckley from the Regional Planning Committee to come talk about the New Links plan that they gave Jefferson Parish and Orleans Parish, and actually St. Bernard Parish around regionalism and expanding opportunities specifically to disabled transportation. And also Laura Bryan to talk about the initiatives in Orleans.
So is this for the next meeting or this for the conference? For the conference, okay. Very good. And go back to the regional, you said that, what were they given?
Sam Buckley is with the Regional Planning Commission, and they created basically a more intentional plan on how we can expand transportation and mobility options throughout the greater New Orleans region. And they specifically targeted part of that conversation around disabled transportation.
Okay.
Now, part of the transportation problem is that they're all local authorities, and trying to cross parish lines is always a pain. So I think that's a great idea. How can we do this across the state?
Yeah, that's the goal, Jim. And now it's getting Jefferson Parish, Orleans Parish, and St. Bernard to play ball together.
And we have Kathy Dwyer and then Karen Scallon who have raised their hand.
Thank you, Bambi. I just want to kind of piggyback on what Jessica said. And I'm glad she added about people with disabilities regardless of age, because I have a similar concern for adults when I think about while my daughter's vaccinated, and I understand some people cannot be vaccinated, and younger children particularly are not able to at this point yet. But when we start returning to services such as day habs, having in-home care starting up again, going back to work, not everyone's going to be vaccinated. So it would be nice to have something presented on how safe is it for those with and without vaccinations. I ended up calling my daughter's doctor and discuss it with her. So I got some, confidence there in what, and relief there in what she suggested. But it probably would be a good educational component for everyone to know what are the risks, what aren't the risks when we start returning to services, be it school, day hab, work, in-home care, what have you.
Thanks, Kathy. Karen?
Yeah, a couple of things on the focus on children. I agree with that. I would like to see something about the science behind the safety of that vaccine for children, the majority of children, because we know not all will be able to take it, but I also have some contacts that I might be able to share that can help as far as speakers go. And then jumping ahead, I'm looking at the history of disability rights movement on community-based inclusion.
Mm-hmm.
I'm not sure exactly what the target was for that. I don't really recall when we discussed it, but something I've noticed is that a lot of the parents who are of younger children don't know the history of the disability advocacy here in Louisiana, and don't understand how far we've come, where we are, how far we still need to go, the players, that kind of thing. And I think that tying into that, not just the overall history, but Louisiana's history, so much has happened. I think in advocacy in the last probably 15 years or more that I've been, well, it's more than that I've been doing it. I think it would be helpful for them to have some kind of perspective on what parents before them have been doing, how we've done it, and that type of thing. So I'm just offer that up. So I do a lot of explaining of that, I guess, in my interaction with a lot of the parents.
Maybe that would be a good opportunity to bring in organizations that have been involved in that advocacy from around the state.
Absolutely.
And this one is actually Lillian was gonna, Lillian's working on this. Lillian's great. She's not here, but we tease at her because she's not here because she's doing a program with Oklahoma. We tell her she's, national now. But if you know Lillian, I've heard her speak on meetings. She's just a great young advocate. And so she's working on this session. So
she just mentioned that she's on, actually.
Oh, she is? Well, Lillian,
Yeah.
you hear me talking about you. Go ahead. You can speak, Lillian. You caught me talking about you.
Hi.
Hey.
Hey, yeah, sorry. I'm jumping in between meetings. Like Ms. Bambi said, I'm also attending Oklahoma's Youth Leadership Forum, which is a blast. But yes, so the history of the disability rights movement, the presentation that I'm currently working on is really about the disability rights movement as far as the passage of the Rehabilitation Act, the passage of the ADA, and even the Invalid Corps and the Civil Wars, and how that ties into our advocacy today. So the first portion will be pretty history focused, but then the second portion will probably be more about how that impacts our advocacy today, and also how learning our history can be used as a tool for people with disabilities to create disability pride and pride in their own disabilities. And I think sharing our history is really, really important, specifically for our people with disabilities and our self-advocates, because I think we all understand that we lack a lot of role models and bigger media of people with disabilities. There's a lot of narratives of pity in the media and our overarching society, and our disability history is actually it's the direct opposite of that. It's a representation of people with disabilities speaking for themselves, making their own decisions, practicing self-determination despite other people saying that they can't. And I think that's a really, really beautiful thing and a really important message for us to share, especially since we have such a lack of self-advocates currently in our advocacy community. So if you have any questions, I'd be happy to answer them. And also, I'd love to discuss it some more with you guys as well.
This is Karen. Lillian, that sounds amazing.
Now we have Jessica Michaud has her hand raised.
Forgot we were supposed to raise our hands, so I decided to try it this time. I have a few things. I really like Lillian presenting this on the history, and I know she'll do really well on that. I also really like when the disability rights movement is tied into the civil rights movement and how that has influenced the disability rights movement. I think that's a really powerful thing. I love the disability rights in Biden era. I think that's going to be really informative. Something I personally would like more information on would be youth self-advocacy. We have so many kids that are nonverbal and struggle. And in particular, I'm thinking of my sons, and they struggle with communication or struggled with communication, and how to go about teaching them how to advocate for themselves. So if we could have, I don't know, maybe some self-advocates help with that or present on that and how they navigate that. I think that would be helpful for parents and other self-advocates as well.
And again, we have Lillian who comes to rescue, and Sherry has that covered. So Lillian, go ahead.
Sorry, y'all. I know I like to talk a lot, but I think that's a really, really fantastic idea, because the goal really with the youth panel is to emphasize the importance of our youth speaking for themselves, right? And I think the panel will only be effective if we have adequate diversity on that panel, not only socioeconomic status, race, etc., but also diversity of disabilities. So we have, chronic illness, maybe a deaf-blind individual. But I think the inclusion of someone who's nonverbal is a great idea, because we often say that, we're going to speak for the people who can't speak for themselves, but sometimes people who can't speak for themselves can still communicate and voice their needs and their wants, right? And so having that conversation of what that may look like for different people, I love that idea. So thank you. I will definitely be reaching out to different people to see how we can make that happen.
Thank you, Lillian.
And Karonda has her hand raised.
Okay. I'm so happy that Jessica Michaud gave that recommendation, and they actually have an attorney that is nonverbal that I think would be extremely great to speak about their work as an attorney and being nonverbal. And that person really rocks. And I heard this person has spoken on many different platforms. Also, I think something that we also fail to address and think about is the diversity in the community of people with disabilities, and how troubling that may be, or how they may be limited to accessibility to certain services because they are a minority, whether it is race, whether it is socioeconomic status, or English language learner, or if the person categorized in the LGBTQ plus community. Because we do have individuals with disabilities that are in the LGBTQ plus community, but they are eliminated or excluded or have limited access to these resources. And so I think that it would be extremely great if we can touch on that, because that does tie into disability pride, but it ties into a different angle, as in how hard is it for you being a minority to actually get access to resources as well as being a person with a disability. Thank you.
Thanks, Karonda. And we really, you notice in bold, like we really wanted to have people with diversity. And so like this, the intersectionality, this first bullet, really we wanted to try and get people to talk about like I think which the point you were getting to, like, what is it like to have a disability and be, in minority religion, or a minority ethnic group, and get people who are really advocates for disability and for their experience of being a minority. So if people, we really want to focus on having people with disabilities being the focus, and while parents or providers are great, if we can find people with disabilities that also represent these other sections of our, of our state, that would be great. And Karen has her hand raised.
Yes, I just wanted to mention, and this is something that, I'm sure some of us here get, but some of us forget about. When we speak about developmental differences, sometimes we need to make sure we're paying attention to people with intellectual differences, because developmental could be physical or it could be intellectual. Someone with intellectual differences, those individuals tend to be left out a lot too, because people think that they're not going to have something to contribute, or, won't really understand what's going on, which is really not the case. And so I'd like to just, emphasize that. And as far as someone nonverbal too, who may be able to be contributing to this discussion or in some way, I just wanted to mention Lucas Dwaron, who is nonverbal, has an intellectual difference, but who's been very successful and has a business, and he's presented before too, so that's another possibility. I know he and his mother have presented before, but in other places, but it's definitely a powerful story that he has. So I just wanted to mention him too.
Anyone else with recommendations for the conference?
Bambi, on the COVID topic, it would be nice to have someone address public transportation. I know in Baton Rouge, they cut the buses back to like 9 people on a bus. But I don't know what the protocol is or what your exposure is in terms of public transportation. If that could get worked in, it'd be nice.
Okay, I'll add that. Anything else? Well, if you have any recommendations, please reach out to me or Jamar or Lillian, because we will quickly be finalizing our plans, and looking forward to another great conference.
Do you have any numbers on how many people attended the conference last year?
We had about 600 people attended last year. It was virtual. In the previous years, when we were in person at the Claiborne building, we had about 300 attendees. So we doubled the attendees last year with virtual attendance. And for those of you who weren't able, didn't attend in any of those years or last year, we had it through Zoom as well as streaming on our YouTube channel.
That worked really well.
I'm sorry, you broke up, Jim.
So that worked really well. It was the first time I had been on the conference, and it was great.
So hopefully we have sharpened our Zoom technology skills since last year, and maybe be just a little bit better, although last year went pretty well, I think. Okay, Lynette, I'm not sure what the next item on the agenda is.
Thank you. Before we adjourn, do we have anyone who wants to make public comments?
Lynette, while we're waiting on public comment, one thing that we didn't include in our notes, although we talked about it, is in regards to the openings on GACDA. We have 4 to 5 seats available on GACDA. People had to resign for various reasons. And so I'm gonna actually put in the chat the link for people to be able to apply to GACDA. And we will put this out in our next newsletter, and then select people to apply. If people have applied initially and weren't selected, you could just reach out and just let me know that you just want your the previous application to be utilized. You can also resubmit an application And as we did for the selection of the committee, we really look for diversity in every aspect, including having a representation from across the state, because it's really important to have people that can talk about what's going on in their areas of the state, and people with disabilities. So anyway, just wanted to share that. I put the link in the chat, and we will follow up with that with an article in our newsletter, which all of you should receive, our monthly newsletter that usually comes out either the last day of the month or the first day of the month. Brenda Cosi has her hand raised.
Good afternoon. Just wanted to comment, definitely appreciated the virtual option for the conference on last year. Stakeholders definitely appreciated it.
Thanks, Brenda. Yeah, that's the feedback that we got. So appreciate that. And just to remind people in regards to that, our conference from last year is on our YouTube channel, the Governor's Office of Community Programs. It's recorded there. And so people can access that. It's publicly available. And Lynette, I think that's all I have.
If there is no other business to discuss, I need a motion to adjourn.
I'll make a motion to adjourn.
Miss Missy Lane made a motion.
I'll second.
Second.
Everybody ready?
Meeting adjourned.
Thank you, guys. Bye, everyone.
Yeah.
Thank you all for participating.
Bambi, I have a question for you once everybody go on this. Sorry.